Hello, my name is Jess Rutherford and this presentation will show how to record an ECG. An ECG or electrocardiogram is performed to assess the rhythm and electrical activity of the heart. In order to perform an ECG, electrodes must be placed in specific positions on the patient's arms, legs and chest wall. Electrical activity is sent via leads that connect to the ECG machine and are recorded, producing a trace which then must be analysed by a qualified staff member. This recording must be done as accurately as possible in order to receive the correct diagnosis. The required equipment that is needed to perform a resting 12-lead ECG is an ECG machine, ECG paper, disposable electrodes, a razor, abrasive preparation pads, and an alcohol-based cleansing wipe. Before beginning the procedure, it is impeccable that hands are washed thoroughly and that the area that the procedure is to be undertaken is clean and safe, and that the necessary equipment is available. Before commencing the procedure, verify that you have the correct patient. Ask for identification verbally by getting them to tell you their name and date of birth. Cross-check this information with the request form. Before commencing, explain the procedure to them and gain informed consent verbally. Answer any necessary questions at this stage. The equipment is now ready to be prepared for the procedure. Make sure the ECG machine is working efficiently and that there is enough recording paper. Insert the patient's details into the ECG machine. While the equipment is being prepared, ask the patient to remove necessary clothing, exposing the chest, arms, and ankles. Once equipment is being prepared and the patient is undressed, ask the patient to lie on the examination bed. Identify the site of the electrodes accurately. Use a razor if required. Then, using the abrasive pads and cleansing alcohol wipes, exfoliate and clean the skin. This is to ensure good contact and therefore producing an accurate reading. Incorrect placement of the electrodes can produce diagnostically significant differences on the ECG. As a result, patients can be treated incorrectly. Ensure the middle of the electrode is placed on the desired position. First, start with the 4 limb leads. On the lower limbs, attach an electrode proximal to each ankle and proximal to each wrist. There are 6 electrodes to attach to the chest. Use the sternal angle as a reference point to count down the intercostal spaces. The second intercostal space is directly below the sternal angle, and so from here you can work out the 3rd, 4th and 5th intercostal spaces. For lead 1, labelled V1 or C1, the electrode is located at the 4th intercostal space at the right of the sternal edge. For lead 2, labelled V2 or C2, the electrode is located at the 4th intercostal space of the left side. For lead 4, labelled V4 or C4, the electrode is located at the 5th intercostal space at the mid-clavicular line. For lead 3, labelled V3 or C3, the electrode is located in between V2 and V4. For lead 5, labelled V5 or C5, the electrode is located to the left anterior axillary line on the same horizontal plane as V4. For lead 6, labelled V6 or C6, the electrode is located at the left mid-axillary line on the same horizontal plane as V4 and V5. Once the electrodes have all been placed in their right positions, the lead clips can be connected to them, making sure they are connected to the right corresponding tabs. The leads are clearly labelled to enable this. Once the leads are attached, the ECG recording is ready to commence. Ask your patient to be completely relaxed and breathe normally. When you are ready to record, double-check the settings and that all of the leads are connected and producing a satisfactory tracing. Press the record button to record a 12-lead ECG and print. Once the ECG recording is printed out, check to make sure the trace is artifact-free and that no extra recordings are needed. Assess if any special circumstances are present, which may require additional recordings to be undertaken. Now that the procedure is complete, remove all equipment and electrodes to allow the patient to get dressed. Inform relevant personnel that the procedure has finished. Thank you for listening.